I'm joined by a dentist. Would you like to introduce yourself?
Yeah, sure. So I'm Dr. Gende, Mayura Gende. My kids go to North Allegheny School, and I have my own practice in Evans City. So Sanika, she's my really good friend's daughter, and she approached to me and said that if I could introduce dentistry and give a glimpse of how the profession is, and that's why we are here.
Okay, thank you so much. So, how would you describe your typical day as a dentist?
So my typical day, Monday morning is always long days, and we always come in thinking that it'll be smooth. But like every other profession, it can be a set of challenges. We have, patients who are scheduled for a cleaning and a schedule. We see a lot of patients for crowns, fillings, things like that. But then also somebody might just call in saying that they broke their front tooth, or we always have unexpected emergencies, and we leave some time or schedule to see them, because dental emergencies, nobody wants to have that. I mean, everybody is really nervous, and those kind of patients we have to prioritize.
Right, yeah. So, I know that before I talked to you, I didn't know that dentists did like crowns and stuff. Is there other stuff that like you do that a lot of people wouldn't think that you do?
Yeah, I mean, dentistry is not just initially it used to be like, okay, you see a dentist, it's an old big guy coming close using a lot of big tools, heavy tools. So 9 out of 10 patients I see even today are very anxious and nervous coming to a dentist. But over a period of years, that has changed a lot. I mean, dentistry has advanced so much. I mean, yes, there is still a little part which all the dentists as a society are trying to overcome, and that's patients' anxiety. The first thing we want to do is make our patients very comfortable, so we are more their friends than their enemies. And that way, most of the people are working towards it. But it has changed, to go back to your question, it has changed from what it used to be with the advancement in techniques and equipment. Now we just don't clean teeth, but there's a lot of ways to saving them. There's a lot of creativity in that. People break their teeth, lose them. So it's kind of giving some patients a smile makeover. Some people, they are not benefited to getting braces when they're young, and now they have nice jobs and they want to correct their crooked teeth, and it could be a little late to get braces. So as a general dentist, you can do crowns, veneers, and give them a very rewarding smile, and they are very contented and satisfied with that look.
Okay, can you quickly explain what veneers are?
Sure. So veneers are like a fake nail. They are something which are like fake nails which go on top of your teeth. So one is you don't have to take out too much of the natural tooth. This is ideal for patients where they have little misalignment, and by that I mean the teeth are little not shaped as they should be in the perfect arch or the perfect smile. So we shape it up. We make a mold, and there is a certain adhesive or a specific glue what we use once they are fabricated in the lab to cement it on.
Oh.
And that's how you change the smile.
Okay.
Mm-hmm.
So is a lot of the stuff you do more cosmetic or like health related?
So as a general dentist, you usually do all different specialties of dentistry. So as a general dentist, you do root canals, extractions, crowns, take care of little kids, take care of elderly patients, do dentures. But then if there's always some general dentists think that, oh, I want to do more to this, and they go and get advanced training or CE courses to specifically direct their expertise in smiles and smile makeovers, and that's what they are called as aesthetic and cosmetic dentists. But even when you are a general dentist, and if you still don't do that expertise, you still can do smile makeovers and have treat patients for veneers and crowns and give them a nice appealing look.
Okay. So, why did you specifically choose dentistry rather than like any other medical career?
To begin with, like I mentioned to you, I wanted to be an architect because art was my forte. Then some after shadowing with an architect, I changed my mind. I wanted to be in a profession which was a blend of art and science. I used to love doing pottery, paint, and a lot of my summer, most of my summer, I used to do some summer camps, which were all related to art. But I used to love biology too. I love treating human beings. I had a passion for animals. Of course, dentistry, we don't treat animals. There are dentists who do that too. I'm not doing that. But yes, and then I thought one of my family members was a dentist. Shadowing and rotating with him really created a lot of curiosity in my mind. And that's how I decided to, I used to love what they used to do. I used to help him out, and as not an assistant, but in the at the front desk or in the lab, and that's what I really made up. That's when I made up my mind, and I decided that yes, I do want to be a dentist. But this is a great profession. I cannot say anything negative, not because I'm a dentist, but really for the upcoming generation, especially for girls, this is a great profession to be in, wherein you can either work for someone, work for yourself, work full time, or have the perfect career balance between your profession and your personal life. And I would not, think twice again to recommend or be a dentist in my next life.
Wow, that definitely sounds really nice. So you mentioned that there wasn't anything you really didn't like about your job and you liked the work-life balance. Are there any likes and dislikes about your job?
Likes and dislikes. Likes are, it's very rewarding when it's not just rewarding when you do something in the patient's mouth and they smile. It starts right when a patient walks in your room or in your operatory. And let me tell you, Sanika, even after being in this profession for so many years, when a patient comes in my operatory, they are like, don't take it personal, but I hate coming to a dentist. I always tell them, I wish somebody would have told me this when I was in high school. I would have never been a dentist. But, that's how there is so much anxiety and nervousness. I mean, who likes to see shots coming at their mouth, right?
Right.
We wouldn't. So it's the same thing. Anyway, so when a patient walks in and I just talk to them, I reassure them. I have ways and means to make them very comfortable in the chair. And then when they leave from here, they are like, oh, I'm so glad I came to you and you helped reduce my anxiety. So that is very rewarding for me. And secondly, of course, when I, take care of their issues, get them out of pain, do something if the patient has an emergency, take care of that, and then it's very satisfying and rewarding when a patient is happy. So a happy patient is something which all the clinicians are looking for.
Oh, yeah, definitely. So, I know that you started your own practice. Can you tell us what it's like to versus like working for someone versus like working for yourself?
So I worked for someone for almost 14 years, 12 to 14 years. I wanted to see what is, the grass is always greener on the other side. I wanted to experience how green it is. So it comes with challenges for sure. Initially, I wanted to take a back step because of my kids. They were small, and I knew that when you start something on your own, or I would start something on my own, it's a lot of responsibility, and I should make myself more time to be available for the profession. So it's a different set of challenges, because when you have your own practice, you're just not a clinician. You just don't come to, a chair and treat a patient, but you have to kind of switch your hats. So you are from a dentist to a front desk person to an assistant to a hygienist. But it is very rewarding. It is a set of challenges. But if you I'm a person who likes to challenge myself. And if one likes to challenge themselves, they can always accept this and make sure that you have a nice cell phone practice.
How would you describe your work environment? Like, is it stressful, social, etc.?
So, as a owner, I have made sure, and I mean, even me as an owner, I learn something new every day, right? But it's very important that you come with a positive attitude and walk in with a nice smile. And when you come with that kind of attitude and that approach, you make the other people happy. And when you make your staff happy, when you make sure, you have to, of course, tell them, address things, make sure they do their job. But when you have positivity at the workplace, it reflects on the staff and it reflects on the patients. And I try to keep that. I have to be strict when it needs to be. But at the same time, we try to have morning huddles where we discuss how our day is going to be. There are always unexpected emergencies, as we talked about. But just, a nice approach without being insensitive, rude, just ask them how their day was. Sometimes, we all just order pizza to make it more nicer. We talk about, or we have something for a patient. If they have been coming to us for a long time, we just give them a little reward and things like that. Always make the atmosphere work friendly.
Oh, that's nice. Yeah, so definitely like your social abilities and your attitude make the atmosphere.
You want to just keep it nice, light, and happy and positive. So your patients and your staff is positive, and they look forward to coming to their workplace.
Okay. How would you, so now that we're like going through a global pandemic, how would you say that's changed how your practice has been working?
So this question is asked to many dentists, and I'm also a part of a group which is called Dentist Against COVID-19, or Dentist Against Coronavirus. And in all this pandemic, has dentistry changed a lot? So no, because we have always taken the standard barrier care and the standard precautions right from when hepatitis B, when it was the onset of hepatitis B, which was a very scary virus which used to get transmitted through blood, or still does, saliva, infected needles. The same with AIDS or HIV. And we as dentists were always very susceptible because we dealt with lot of aerosols. And when I say aerosol, it's the fluids, saliva, blood, and we are always in close contact with all those liquids or fluids of our body. So we always use standard precautions covering all our equipment, the operatory. When I say operatory, it means the chair, the light, the suctions, cleaning, after a diligent cleaning after every patient. We cover the patient, make sure they have napkins. So all those things was the part of PPE which was been always taken care of in the dental profession. Now with the pandemic of COVID, the only difference is we screen our patients, make sure that their symptoms are negative. They come in with a mask, they sanitize their hands. When they sit in the chair, that's the only time they take out the mask. And we use either an N95 and a surgical mask on top, or just a level 3 and then a level 1 mask on top. It's one and the same to protect ourselves. And then of course we have the visor But all those things, that kind of PPE was worn even before. But screening the patients and then wearing a mask while entering the office are the 2 or 3 requirements which have changed.
Okay. So to wrap up, what advice would you give to high schoolers that are interested in becoming a dentist?
So I would say that I have been in this profession. I graduated when I was 21. I don't want to give my age now, but I will. So I've been doing this for 24 years. And in 24 years, this is a profession which is so rewarding that you will never, I mean, there are challenges in every profession, but dentistry is something which is a very rewarding profession. It's a perfect profession for boys and girls, especially if you want to balance your personal life and professional life. This is a profession you can seriously think of. If you want something which will show your science and art, there is no better profession than dentistry. You can have it has different kind of avenues. You can be a general dentist and treat older patients and younger patients and kids, or you can specialize in oral surgery, ortho, or other specialties and do that specific kind of field. So I feel that if you decide to be a dentist, just like me, I don't think you will ever look back at any other profession. And also for your friends or anyone, if they would like to know or have a glimpse or an insight of dentistry, I would be more than happy to talk to them and give my email and share with them the information.
Okay, thank you so much for
Thank you
this
so
interview.
much. Thank you for thinking about me.
Okay, thank you so much for watching this week's video, and I'll see you in the next one. Bye!